welcome to Talkin Telehealth. I'm Erika Grau.
And I'm Kathy Ford.
Telehealth is having a dramatic impact on the way patient care is being delivered. On our show, we'll examine how telehealth can simplify communication, improve office workflow, and most importantly, drive better patient care. In addition to hearing some great clinical stories about telehealth in practice, we'll talk about where telehealth is today and where it's going, including how the latest regulations are impacting provider operations and reimbursement. You can find podcasts of previous episodes of Talkin Telehealth on our program page at healthcarenowradio.com and rhinogram.com. Be sure to follow us on Twitter at #TalkinTelehealth and follow us at Rhinogram on Twitter. All right. Welcome back, everyone. Kathy, it's so great to chat with you today. I really enjoyed last month's episode with Jennifer Garrison of Charleston ENT. What an interesting interview. It's so cool to see what they're doing at their facility.
It was really terrific to get some time with Jennifer. They're doing very innovative things to address, obviously, the changing times and still deliver fantastic service to their patient population, and is continuing to think about how they can continue to stay connected. And so that's what we love to hear. And we'll look forward to catching up with her later on in the year, maybe early next year, and see what else they have implemented as we get into the fall season.
All right. As the summer starts to come to an end, we have some breaking telehealth news to fill everyone in on. President Donald Trump signed an executive order on August 3rd, directing multiple agencies to improve telehealth access and coverage in rural America. Kathy, I'm dying to hear, why this is such an important news and what this means for our industry.
Yeah, this was very encouraging to hear and to see with swift action put into place. We have talked a lot about, over this last year, the gap that exists today in access to care, delivering care, not only resources, meaning clinicians and services, but also technology and, what some of the realities there are. So essentially what is interesting about this is, rather than just waiting for our country to quickly build out infrastructure and put dark fiber down so that these rural communities have access to the internet, which is still very much needed. It's certainly needed for other entities like education and the financial sector and others. However, we cannot wait for that to come into play for healthcare. Essentially what this has done is the Trump administration made a long list of temporary regulatory changes, which is going to increase the telehealth usage. These changes are things like increasing the reimbursement rates, which is very much needed for some of these services, expanding services Medicare would cover, increasing provider types covered to provide telehealth services, and then, of course, allowing Medicare patients to receive certain telehealth care in their home. So just further extending that flexibility, implementing the proper coding so that there's no deterrent for that care to be delivered in a more extended way. The payment model also is giving essentially seed money to bring multiple providers into the community together, organize healthcare delivery systems, and explore more value-based care models so that, again, we're focusing on the health of the overall population versus just an overall volume play.
So let's talk about what that means for technology and access for these people in these rural communities.
Right. So with the executive order and the expansion of codes, you still need to be able to deliver that care, of course. I was also encouraged to see the CMS fee schedule proposal for 2021 for physician fees specifically, which have call-outs around FQHCs and rural health facilities on expansion of care types, those sorts of things. So with that all happening, these are all the best things and all the right sorts of motivators and incentives. However, we still have this issue of the technology from a gap standpoint. So what we want to continue to encourage is for all of you that service populations that have lacks or or gaps in their broadband coverage, you really need to look for a virtual care platform that's going to be able to reach out to your patients that may only have cellular coverage. Also, if you think in terms of a virtual visit, and while still a lot of the codes are focused around video consults or synchronous consults, which makes sense in a lot of settings, but again, it's not the most convenient all the time because it still requires at least two people to be available at that same time. We know from other Rhinogram users and certainly other facilities and health systems that we're in having great conversations with that now that everybody's sort of had a chance to take a step back, pause for a second, and do some real analysis around what they need for a solution, it's become clear that it's not just video, so it's not just a piece of technology, and it's not just any video that's going to do it, right? So, Erika, we have seen all sorts of crazy things being used. Some of our clients, before turning on video, certainly were kind of grasping at straws and implementing, we'll just call them off-the-shelf solutions that were built for other purposes. So you know what I'm talking about there?
I sure do.
And I love the purpose statement here. I actually had a fantastic conversation the other day with a health system CEO and just hearing more about what he's looking to do from a strategy perspective about extending virtual care, more concierge-like medicine methods, but also making sure, because his population is both urban and very, very rural. And so in thinking about that, what he realized, and the term that he kept using, was an application that's made for the purpose of healthcare. So, there are lots of conferencing solutions, work conferencing solutions, things that are on our phones, that give us the ability to open up a video chat. All of those things are available, but they are not at all designed for the purpose of delivering a clinical consultation or telehealth. And so in thinking about not only your rural healthcare strategy, but then kind of layered on with that, I think about that entire virtual care platform. And then remembering that all of your instruments within that platform, including video, should be capabilities that were designed for the purpose of care and not for business meetings or family group chats or even there are some video vendors out there that have, say, extended into healthcare somewhat, meaning it looks like they are offering a BAA potentially. Mm-hmm. But I'd even tell you this, that what we hear, and for those that are really thinking about the entire patient journey, they're realizing that just a video solution, even if it's HIPAA compliant, is really more of an interruption to the total workflow, to delivering care seamlessly, easily, where the patient lives, where the provider lives potentially. So this is the evolution point that we're in right now.
I love that. And you know what? This is like kind of the perfect transition to kind of roll into our next segment of this episode. Last month, we mentioned we were going to dig deep into the world of telehealth as it relates to video. So Kathy, there's so many different options that people can choose from. You kind of touched on, maybe some of the options that weren't built for healthcare and why that's an issue. But let's kind of get Kathy's guide on the best video solution.
I'm happy to give some pointers about what you might want to be looking for while you are thinking about your virtual care platform approach. And by the way, if anybody out there has access to Gartner's fantastic research, there was recently a report that was published at the end of July, and it's called Defining the Virtual Care Market and Its Opportunities. It's about a 20-minute read or so, but it's pretty comprehensive as far as also talking about more than just video, and what does that capability mix need to look like in order to buy something and implement something that's going to truly service the entire healthcare delivery organization's needs. So first, let's talk about the patient experience. This is, more and more becoming front and center, which is, fantastic. But the patient experience really begins with their ability to get connected. And a lot of these solutions, in fact, almost all of them, require some kind of patient portal to log into, an app to download. And we have talked about it over and over again, but I'm going to say it again, but especially for video. When somebody is taking the time to get onto video, this is the last thing that they want to have to contend with, because if they didn't know up front that they needed to create a login, create a user ID, and get all that validated in advance, then you could really have a mismatch of expectations with your provider, whether you're going to make the appointment, the virtual appointment as a patient, whether you allotted enough time to get ready for it. So if it isn't convenient, meaning the patient doesn't have to learn or do anything new, nothing additional. So applications like Rhinograms and some others in the market that have the ability to send a secure link through text to initiate that video consult is first and foremost going to deliver the best experience. So you want to start there. Also on the experience side, what we have heard with some of the other video-only solutions in the marketplace, that's really their sort of bread and butter, or what their only focus is a lot of times because they're freemium type of solutions. So people think they really hit it big because they could get this video solution for $30 a month or something like that. They're actually losing out on a whole bunch of other benefits that, the old adage, you get what you pay for, really starts to come into play. So what I mean by that, firstly, starts with just the video quality, audio and video. Freemium or free type solutions are in most cases using just the lowest quality of video streaming and video management, let's just say, as far as bandwidth requirements and compression and things of that nature. And so using a solution, again, if you think about design for the right purpose, that was built for not only more than one person joining that video if needed, like an interpreter or like another family member. So having that additional breadth of that consult, but also making sure that you are investing in a solution that is going to deliver very high quality video and audio for that entire experience and for every time that video technology is being used. There's nothing more frustrating than I can't hear you. Can you hear me? We hear it on work videos, right, Erika, all the time.
You see the person moving their lips and nothing's coming out.
Exactly. Or it looks like you're connected, but nothing's happening. So that quality and the technology behind that virtual care experience is going to be, it needs to be high priority. And because we're so early in these times, not all video is created equal. So it's important to really explore the quality measures that your vendor has gone through to ensure the highest quality and experience, and voice of customer feedback on that.
Definitely. And Kathy, I would think that, you mentioned all of, a lot of practices we've seen during COVID, they've implemented, a new video solution or, a new telehealth program. What are some of the issues of people managing so many vendors?
Well, it's just a completely broken workflow. So when you need to coordinate the appointment and change maybe the day and time that video consult is going to take place. So you do that in one system. You need to make sure that you collect payment for either co-payment for that video consult, since nobody's walking into your doors anymore, or what system are you going to use to do so, and to ensure that all of that's been taken care of, whether it's just a flat fee consult that you're going after, or part of your copay, whatever it may be. Insurance changes, also forms, all sorts of consent. Informed consent is now very much part of our new telehealth go forward world. And if your team and your patients have to contend with logging into a portal, calling the practice on the phone to do this, faxing something from somebody's fax machine to another fax machine, it just really creates more and more barriers for this to ever take place. So it really takes away what should be the easiest way to deliver care in the most convenient way for everybody. It suddenly becomes super inconvenient. And so, ways to prevent this is, using the phone is sort of the last resort that we want to have to introduce or to implement as a part of a virtual care strategy. So having a platform that allows your staff and the patients to be able to communicate asynchronously, which by that we mean by text message is sort of the primary way that we all know of. But I'd also tell you that social media is the other place where our patients live. And so if you don't have a way to open up that channel to your patients that's secure and also convenient and consolidated for your staff from a messaging standpoint, you have a gap. I listened to a fantastic discussion, a panel with healthcare executives, and I loved hearing the fact that this one healthcare executive for a very large group on the West Coast was talking exactly about social media, and that all health systems have to figure out how to also deliver care through social media, because it's where our patients are living and spending a lot of their time. And so if we want to make sure that patients follow their care plans, stay connected, are engaged, then we've got to go where they are. And that's where they are. So a solution like Rhinogram that has Facebook Messenger integrated, so bi-directional conversation can happen through Facebook Messenger. So for sure, nothing new for the patient to learn, because we all know, just about everybody knows how to use Facebook Messenger. So that can be their preferred channel, their preferred communication approach. And all of that coordination and setup of before a video consult can happen through Facebook Messenger securely. And all of that conversation is going to sit in the Rhinogram platform, for example, forever. So permanently logged, encrypted, and accessible and referenceable, but super convenient for the patient. So all the ability to basically balance all of that coordination, questions, preparation before that video consult is a really important part of your virtual care platform strategy.
I love that, Kathy. I love we use that a lot here at Rhinogram about meeting the patients where they live. And I think it's so important to stress that more time is spent on care and less time is spent on, the practice or the facility teaching someone how to log into the portal or teaching someone how to use a software. Kathy, I'd love to hear kind of what you think is the future of telehealth more as it relates to a, virtual care platform strategy. There's a lot of players in the market, and I think there's probably a lot of confusion on what's happening next.
There is still a lot of confusion, and certainly we've seen a number of mergers and acquisitions that will probably make this market a little bit confusing to navigate for the time being. However, I think this is a great opportunity to start talking about the virtual care platform as a go-forward strategy and really diving more into why a virtual care platform versus, say, a physician service augmentation approach is not really going to be our go-forward, in my opinion. But that when we look across the care delivery models, so meaning a consumer-focused one, like a CVS clinic or some kind of, dial-a-doc sort of offering, to moving it, kind of progressing into more comprehensive care needs. So patient-doctor relationships for your regular kind of ongoing well care. Then you have your specialists for patients that are in with chronic conditions, chronic care scenarios. And the progression continues to move up with acuity, right? So do you want to have 4 or 5 different platforms for those different care models? Or should we be thinking about a virtual care platform that's going to give your organization and all your different specialties the ability to leverage one platform that is ubiquitous across different specialties and different care models? So can service I just have a low acuity need, but I want to use somebody who's local because I may go and see them the next time I go have a physical or for my regular care and I don't have a doctor. This is so common today. And then also be able to keep that relationship and let that primary care or that local physician be able to grow their patient base, stay sticky with their patients. And then again, from a chronic care standpoint, that engagement, that ease, that connection on both sides. So is that provider able to use this platform to stay in touch with elevated patients? So how does a platform help that provider organization know which patients are out of range or in difficulty, and who is the best person to respond based on that particular health system setup? So, and actually what I didn't even mention in all those different care models, maybe it's in the patient to provider sort of well care model, but concierge medicine is growing like crazy. And I mean, why not, right? Again, it's a very consumer oriented approach to care. It's, I'm going to pay, a premium to have care when I want it, the way I want it. And the only way that that's going to really come to fruition is if it's super convenient for the patient. So again, having a platform that gives your health delivery organization the opportunity to grow that out and only have to have one platform, not to have 5 platforms for the different care models and for your different specialties and for your different patient needs. It should be a single platform that can move seamlessly across those different levels of acuity.
We're clearly at the beginning of this revolution of virtual care. Knowing that, there's clearly a solid decade of really cool innovation that we're going to be seeing as soon as next year. Kathy, I think what our listeners would benefit from is hearing where the future of virtual care is going and companies like Rhinogram, where they're going.
I agree. There's a lot to unpack, as the saying goes. And I would love to kind of break it up a little bit and let's talk about what is out there today, some of the pros and cons of what we are seeing in telehealth solutions and where the virtual care platform is moving towards when we continue to think about the patient-centered home and care where the patient lives, which again is work and home, the car, school, friend's house, anywhere but in the traditional brick and mortar. So lots and lots to talk about, some fantastic reference material also I'd love to share as well. There's a hype cycle out there for virtual care and telehealth technologies as well, which is pretty cool. So I'll reference a little bit of that too, and look forward to the next conversation.
Another episode of Talkin Telehealth you won't want to miss.
With that, I want to wish everybody a great end of summer, and as usual, stay healthy, stay safe, wash your hands, and wear your masks.
Awesome. Thanks, guys. We'll see you next time. Thank you for joining us today on Talkin Telehealth, recorded at Rhinogram headquarters in beautiful Chattanooga, Tennessee. You can learn more about Talkin Telehealth on the show's program page at healthcarenowradio.com or rhinogram.com. Find us on iTunes under Healthcare Now Radio, or tune in Monday through Friday and listen through your smart speaker by asking, "Play Healthcare Now Radio." Be sure to connect with Rhinogram on Twitter, Facebook, and LinkedIn. We'd love to hear from you. And remember, if it's in the world of telehealth, we're talking about it.